Hi, I'm Ryan Payne with Salina Urology Associates. I'm here to talk about robotic surgery. Robotic surgeries allow doctors such as myself to really do more complex, major operations through a much more minimally invasive approach. Salina Regional Health Center has recently brought on a single port robot, an SP Vinci, that has allowed us to make a further advance in that product for our patients.
Well, Dr. Payne, thank you so much for coming on the show. We're going to be talking about robotic surgery. I know you've been at the forefront of robotic surgery here in Salina since Salina Regional bought their first robot in 2009. Why don't you talk about how it's transformed your urology surgeries?
Urology and robotics kind of grew up together. Urology was one of the first users, and I was lucky enough to train in a period when robotics was very new for a lot of people. And so I was lucky enough to come to Salina as one of the first trained surgeons here on robotics. And Salina Regional got a robot when I first moved to town. We have been doing robotics here since. And really, robotics has been a big change for urology. You know, we work on organs that are typically very difficult to get through very invasive incisions when these things are done in an open fashion, especially for our cancer cases. And robotics has really allowed us to move to a much more minimally invasive approach to our more major operations for our sicker patients with more serious diseases.
Good. Well, you mentioned minimally invasive, and I think that's where the new robot comes in, the Vinci SP.
From a urologist perspective, SP really gets us back to where we want to be. You know, a very brief description, there's two main cavities of the abdomen, the retroperitoneum and the peritoneum. The peritoneum is where all your intestines live and most of your GI organs, and the retroperitoneum is where your urinary tract lives. And the way we do laparoscopic surgery and through the older versions of the robot, we're through the peritoneum. And this allows us to move ourselves back to where we're most comfortable in the retroperitoneum and avoid really any manipulation of bowel, any manipulation of other intra-abdominal organs. And we do this still through very small incisions, most of the time with a single incision. SP stands for single port. And you know, we're doing both these surgeries as outpatients now. People go home the same day. About half of them are narcotic free. They don't really require any pain medicine more than Tylenol and ibuprofen. Because they're going home the same day, they're back to work sooner, their time to full recovery is sooner, their time to full function is much sooner. And so the amount of time that they're having to take out of their lives to deal with their cancer has been greatly reduced. And then the intensity of that process is much down as well.
Dr. Payne, thank you so much for coming on the show and for some great information. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on X and Instagram.